Imagine you're watching a home renovation show, and they start ripping up floors, tearing down walls, flipping everything over, and then they just leave, leaving the homeowner with furniture in weird places, debris everywhere, and no idea how to fix it. That's basically what happens after we have children. We're just kind of sent home with the instruction of don't lift anything heavier than 25 pounds and rest. It's like, okay, but what do I do? That's basically how my body felt after childbirth. Our pelvic floor and our vagina have been through a total demolition. Things feel different, but don't worry. I'm not leaving you in chaotic mess. In this video, I'm going to walk you through what's actually happening down there, what's perfectly normal, how to recover so that you can feel at home in your body again. Now, whether you have had a vaginal birth or a C-section, there will be changes to your vagina and pelvic floor after birth. By knowing what to expect and how to care for your body after birth, you can have the best postpartum recovery possible. I'm a certified personal trainer, postnatal yoga instructor, and lactation consultant, and for the past 5 years, I've been helping mothers feel confident and strong and in love with their postpartum bodies. So let's first talk about what's happening during pregnancy that causes these changes. And I'm going to be focusing a lot on vaginal births. But I do want you to know that whether you've had vaginal birth or a cesarean birth, you will have changes to your vagina and pelvic floor. Okay. Exactly is the vagina and your pelvic floor made of? Well, the vagina is a living tissue filled with muscles that stretch when you give birth. So think of your pelvic floor kind of like a trampoline. It's strong, it's flexible, holds everything up. But then childbirth comes along, and suddenly that trampoline feels a little bit more like saran wrap that's been stretched a little too far. Sound familiar? Don't worry. We're diving into what happens to your pelvic floor after birth, why it's not broken, and how to get it bouncing back, literally. During your pregnancy, your estrogen levels are going to rise, and so will a hormone called relaxin. The placenta and the ovaries produce this hormone, which causes the ligaments and the joints in your body to loosen up. It's also why deep stretching and plyometric quick movement workouts are not advised. My hair, get out of my face. Thank you. This is why deep stretching and plyometric quick movements are not advised during pregnancy. You can end up overstretching and causing injury more easily. But this extra looseness in your body, it carries over to the vagina and the pelvic floor. Relaxin causes the ligaments to become more stretchy in the pelvic area, loosening the tissues around the vagina and the pelvis. Couple that with the added weight and pressure of carrying a human and a whole new organ, you can see what's happening. It's getting stretched. And it's this stretching and loosening that makes way for the baby to move through the cervix, through the vagina, and out into the world. After pushing the baby out, you might notice a few changes. Number 1, soreness and swelling. This typically is the first 7 to 10 days. As you'd expect, your vagina area, the perineum, will be very sore after birth. The level of soreness you experience usually is determined by the type of tearing that you've experienced as well. Using a peri bottle with warm water and padsicles can really help to just ease that comfort and give you a little bit more rest down there. If you have experienced a first-degree tear, your skin around the vagina opening might not need stitches and should heal within a month or so. However, if you have experienced a fourth-degree tear, you might need surgery to repair that torn muscle. Recovery from this can take up to 12 weeks and can also lead to scar tissue. Another change that you're going to notice is changes to your menstrual cycle. If you are exclusively breastfeeding, you're doing no supplementation at all, typically your period will not return until you start introducing foods to your baby or you start supplementing them with another food source. If you are supplementing in any way or giving formula, your period can return within 3 weeks. But this is also going to get into lochia, which is separate from your menstrual cycle. You might notice also that your menstrual cycle is heavier or lighter than usual. And that's because your estrogen levels are usually lower, which means the uterine lining might be thinner than normal. But if your estrogen levels increase, you could see your lining build up more quickly, which causes a heavier period. Another change you're going to notice is dryness. This is also because of estrogen. These estrogen levels are responsible for lubrication, so coconut oil is going to be your friend. Appearance and color changes sometimes as well. This is because of our hormone levels. Hormones are doing amazing things in our body, but they're going to be changing throughout our pregnancy, and this can have an impact on things like the color and appearance of our labia. With a rise in estrogen and progesterone levels, you might even experience an increase in blood flow. Plus, this rush of blood flow might even cause it to appear larger as well. For most women, their vagina returns to its normal state within a few months after birth. But the pelvic floor is another story completely. This pelvic floor, the unsung hero, is left stretched from carrying all of this weight and pressure, and it does not immediately tighten back up. Actually, it will worsen over time if we don't actively try to heal it. And we aren't taught this. This should be like basic education. We should be taught this after having a baby. Here are a few signs that you have a weak pelvic floor. Are you peeing your pants every time you sneeze? Experiencing a little leaking when you cough? Does your pelvis feel heavy and achy? Is your back hurting you? Is that intimate time with your partner just not the same after birth? Are you accidentally passing gas? Well, you just might have a weak pelvic floor. This is all very common to experience after birth. And many women are actually also left experiencing prolapse of some sort. So leaking, urgency in peeing, feeling heavy in your pelvis, less satisfaction, feeling looser, lower back pain, gas just slipping out, prolapse. All of this has to do with pelvic floor. What do we do about it? Change comes through consistency, and we need to consistently train and strengthen our pelvic floor muscles so that they can tighten and relax when needed. How do we do that? I've created a 6-week plan to help you heal your core muscles and strengthen your pelvic floor after birth, and it's right here. Hope it helps. Love ya. See you, pizza.